Are knee injections a quick fix or the key to lasting relief? Let's break it down so you know exactly what's best for your knees. Hello, this is Dr. Siddharth Tambar, specialist in rheumatology and regenerative medicine and physician here at Chicago Arthritis and Regenerative Medicine. My goal is to help you better understand your musculoskeletal health and empower you with the knowledge to make the best decisions for your care. Let's dive in. Knee pain is one of the most common issues people face, whether from osteoarthritis, injury, or inflammation. Thankfully, there are several injection options that can provide relief and help you stay active. Today, I'll explain the different types of knee injections, when each one is appropriate, and the pros and cons of each approach. By the end, you'll have a clear picture of which treatment might work best for you or your loved ones. Knee pain can happen for many reasons: wear and tear, sports injuries, or conditions like rheumatoid arthritis, psoriatic arthritis, or osteoarthritis. When conservative treatments like physical therapy, supplements, or over-the-counter medications are not enough, injections can offer relief. They're not just about managing pain. Some options also work to reduce inflammation long-term and improve stability by addressing underlying issues like instability. But choosing the right type is crucial, and that's what we're unpacking today. Let's start with corticosteroid injections, often called cortisone or steroid shots. These have been around for decades and are used to reduce inflammation quickly. When should you use this? Cortisone is ideal if you're dealing with a flare-up or swelling of inflammation, especially in conditions like rheumatoid arthritis or gout. The pros are that it works very fast, usually within a few days, and it's great for short-term relief or inflammation. The cons are that the effects are temporary, lasting for weeks to a few months, and repeated use can weaken cartilage and tissues over time, which can worsen instability. That's why I recommend these only sparingly and for specific situations. The second type of injection are hyaluronic acid injections. Hyaluronic acid injections, sometimes called gel injections, mimic the natural lubricating fluid in your knee. So when you use these are best used for mild to moderate osteoarthritis where the joint has lost some lubrication but isn't severely damaged. The pros are that it improves lubrication, reduces inflammation and stiffness, and protects remaining cartilage, and relief can last up to 6 months. These are healthy for the knee and do not have significant breakdown or side effects long term. The cons are that results can vary, and it may not work as well for more advanced arthritis. Plus, it takes a few weeks to notice improvement. Hyaluronic acid injections work by reducing inflammation longer than steroid injections. While the treatment is straightforward, ultrasound guidance ensures that the injection reaches the correct part of the joint for optimal results. The next 3 injection treatments that I'll talk about are considered regenerative medicine options. They work by improving stability of the joint and reducing inflammation longer term, resulting in reduced pain and better function, which then leads to improved quality of life longer term as well. With these options, we treat not just the joint space, but the surrounding tissues as well. An essential concept for these treatments is called biotensegrity. The idea that the knee's function and stability depends on the balance and strength of all the surrounding tissues. By treating not just the joint, but the ligaments and tendons and other soft tissue structures, we can stabilize a knee, reduce pain, and improve function even more. Biotensegrity is essential for prolotherapy, PRP, and bone marrow concentrate therapies. By treating the surrounding structures around the knee, we get much better results as compared to just injecting into the knee. That is one significant benefit compared to steroid and hyaluronic acid treatments. So the third type of injection that we're talking about are prolotherapy treatments. Prolotherapy is a regenerative option that involves injecting a solution, often dextrose, to stimulate tissue repair and strengthen the surrounding structures. This ties directly into the concept of biotensegrity, which is the principle that healthy, stable joints depend on the balance and integrity of all the surrounding tissues, ligaments, tendons, and fascia. So when would you use this? Prolotherapy is great for mild instability, ligament injuries, or when pain stems from weakened or loose tissues. Pros are that it's straightforward and cost-effective compared to PRP or stem cells. It strengthens and stabilizes tissues over time, reducing pain and improving function. The results last longer than steroid and hyaluronic acid injections. The cons are that it can take multiple treatments are often needed, and it's most effective for mild to moderate cases. And like all regenerative medicine treatment options, while it's low risk and effective, it is typically not covered by health insurance at this time. Proper diagnosis is crucial here. Using ultrasound guidance, we can precisely target the ligaments and tissues contributing to the instability, optimizing treatment outcomes. The fourth type of treatment that I'd like to talk about are platelet-rich plasma injections, or PRP. PRP is a treatment that uses your own blood, spun down to concentrate the platelets, which are rich in growth factors. This treatment focuses on reducing inflammation, stabilizing tissues, and improving function. So when would you use this? PRP is ideal for early to moderate stage arthritis, tendinitis, or to address instability and pain that's disrupting function. The pros are that PRP can be tailored to specific tissues, reducing inflammation and enhancing stability. The effects can last 2+ years, and PRP is stronger than dextrose prolotherapy. The cons are that it takes a few weeks to see results, and there's moderate inflammation for 2 to 5 days after treatment. Next, we have bone marrow concentrate-derived stem cells. Bone marrow concentrate-derived stem cell injections are an advanced regenerative option that uses your own cells to optimize tissue function and address instability. These treatments emphasize stabilizing the joint and improving overall function, which aligns directly with the concept of biointegrity. So when would you use this? This is best for moderate to more advanced arthritis or when other treatments have not worked. The pros are that these injections target instability, improve structural support, and reduce inflammation. The results can last years in some cases, typically improving your knee arthritis pain for 5 years. This treatment is stronger than PRP as well. And note that we frequently combine bone marrow concentrate with PRP to get a stronger and more beneficial effect as well. The cons are that the treatment is more intensive, and like PRP, it takes a few weeks before you start to see results, and there is typically 2 to 5 days of inflammation post-treatment. A key takeaway to all these treatments is that image guidance is important. The effectiveness of these knee injections relies on precision. That's where ultrasound and X-ray guidance comes in. It allows us to see exactly where to inject, whether it's the joint, the ligaments, the tendons, or other soft tissue structures. This level of accuracy improves outcomes and ensures we're addressing the right structures. In particular, when we are injecting your own cells, including PRP and bone marrow, image guidance is required to most accurately deliver your cells where they are needed. Not using image guidance will result in worse outcomes. Knee injections can be game changers, but they're not one size fits all. Each option has its time and place, and it's important to have a personalized plan. At Chicago Arthritis and Regenerative Medicine, we specialize in treating instability, optimizing tissue function, and helping patients achieve better outcomes with minimally invasive solutions. If you found this helpful, give us a like, subscribe to our channel, and share with someone who might benefit. You can learn more about our work at chicagoarthritis.com by connecting with us or on social media. Thank you for watching. This is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. Remember, you have the power to take control of your health. Live well, and see you next time.